Coming up, we'll be on location at Perfect Smiles of Reston in Reston, Virginia, discussing Invisalign, one of the latest advances in orthodontics, and how Invisalign can help straighten your teeth and give you that beautiful smile you've always desired, with one of this region's top dentists, Dr. Aramesh Darvishian. Dr. Darvishian is among Northern Virginia's leading Invisalign providers. Welcome, Dr. Darvishian, to the Top Doctors Interviews program.
It's an honor, and I appreciate you taking the time to be here today.
Well, it's a pleasure. We've got so much to talk about. There's been so many advances in dentistry over the recent years, and more specifically, I'd like to focus on an advancement related to orthodontics, and that is Invisalign. Invisalign is really changing the way people are able to get that perfect smile, to move teeth, to get the orthodontic treatment. There's so many benefits, but people don't really know exactly what it is or how it works. Can you please tell us what Invisalign is, Doctor?
There has been a great shift towards digital dentistry in recent years, and Invisalign falls into that category. Invisalign currently is the most advanced clear aligner system out there, backed by years of research. It uses a material, SmartTrack material, to get a more comfortable fit for the patient. There have been over 11 million completed Invisalign cases to date. And Invisalign uses a series of clear trays to gradually shift the teeth to the ideal alignment. So the movements have become very predictable, and we can complete an average Invisalign case in just a few months. Despite what most people think, Invisalign is not a purely cosmetic procedure. It falls into the preventive dentistry category, because basically by aligning the teeth and distributing the forces evenly, you're preventing future damage to the restorations and the tooth structure.
And what kind of orthodontic problems does Invisalign address?
Invisalign can basically correct any misalignment issue, short of structural issues, which if you have a class 3 where the jaw is forward, you need surgery to correct that. And obviously, kids under 12 are not a good candidate for Invisalign. But short of that, I basically tackle almost any other case with Invisalign with great results.
And as far as the patient benefits, what would you say are the key benefits of Invisalign as compared to your traditional orthodontic braces? And
the number one is the fact that it's clear for obvious reasons, less noticeable. With Invisalign, it's so much easier to keep your teeth clean. With wires, you have food getting caught in there, which can cause bad breath. With Invisalign, all you have to do is rinse the tray, put it back on after you eat, so it doesn't really change any of your routines. We never see any bone loss or root resorption associated with Invisalign where we see with braces. And again, because the movements are so gradual, you don't really have any sudden tightening of the wires that could cause that. An inconsequential side effect of Invisalign actually is that it's been reported on average you can get 10 to 15 pounds of weight loss. And again, that's because most patients don't want to deal with the hassle of removing it and putting it back on. With Invisalign, we also can use accelerating devices. So you can actually bite on a device with the trays on a few minutes a day. And what that device does is accelerates bone movement around the teeth. Again, how orthodontics works is the tooth moves and then the bone follows. So by accelerating that bone movement, we can finish most cases twice as fast. And those are great, if someone is getting married or moving out of the area and we have to finish quickly, that comes in handy. Also, the trays and the retainer make the best whitening trays. They're custom fit. So most of my patients, use it. We provide them with the gel, and they're whitening their teeth all along the treatment. So by the time we get to the end, they got their pearly whites. Although we do include a complimentary laser whitening at the end as well. Invisalign surprisingly also works a lot faster than braces because it's moving all the teeth at the same time instead of individually. With braces also, you can have wires loosening and poking the patient, an extra, office visit required to address that. So with Invisalign, we don't have to deal with all that, so it's a lot more comfortable for the patient. Invisalign also uses a smart track material, so it makes the fit of the trays very comfortable. And again, because of the smart track material and also gradual movements of the teeth, there's no really pain or soreness associated with that.
So it seems like a no-brainer, Dr. Darvishian, because you're not only getting great results with the Invisalign, but you're also getting less discomfort when you said the poking wires and things, much more convenient. You can have public speaking, they're invisible, people can't see them, so aesthetically there's huge benefits as well. When you add to that it really corrects your teeth in half the time or even less.
Yeah.
I mean, it's really like a no-brainer.
Definitely, definitely. And with the advancements in technology, I really think we can tackle so many more cases with it now than we could years ago.
Now, what's the patient process? Say a patient just kind of figures out that they need braces or they need Invisalign, they're kind of interested in Invisalign. What's the process that they would go through once they contact you?
So the first thing we do is we schedule the patient for a complimentary consultation at our office. During that visit, I basically go over their specific misalignment issues and what the consequences would be if it's not corrected long term. For example, if they have crowding, it's harder to clean around the teeth, harder to floss. You get more cavities, more tartar buildup, more bone loss. And when bone goes down, gum follows, so we see a lot of gum recession as patient ages. And if the patient has edge-to-edge bite, where they wear the teeth down with time, they lose that vertical dimension, and those are mostly the people that at a later age need full mouth reconstruction, which can be very costly. Also, whenever I see patients with overjet where the top teeth stick out, we always see these top teeth, patient presents with crowns or restorations on these upper front teeth, and that's because they're not protected by the lower teeth, they're more exposed. And again, if they're more susceptible to trauma, with time. So basically, I go over, bite issues specific, to that patient and how Invisalign could help prevent, these damages long term. Once I answer all the clinical questions for the patient, then we go over, financing options. We do work with a third party so we can break it into payments for them. If patient has no questions, no clinical questions or any financial issues and want to start at the same visit, we do give them an additional discount for saving, additional appointment and chair time. And most patients choose to start the process same visit as the consult. We only need a couple extra minutes to scan their teeth. We have the iTERO scanner, so there's no need for those, gag-inducing impression material, which is very uncomfortable for the patient. So basically, with the iTERO scanner, we can scan their teeth, and the lab receives the 3D imaging with the click of a button. And usually within 2 weeks, we have their trays in our office ready to go.
Oh, that's another huge benefit, because I was one of those kids that had braces, and I remember the gagging with the goopy stuff when they were taking impressions.
No fun,
Exactly. Now, what kind of results are your patients seeing from Invisalign?
With my experience in combined with the advances in technology, I've done thousands of Invisalign cases, so the more of something you do, you become better at it. And also, like using the iTERO scanner helps capture the teeth more, the 3D image of the teeth more accurately, because there could be distortions with the mold, but we don't have any distortion with the technology. So basically, with all the advances, most of my average cases finish in just months with great results. And the finishing touches make a big difference. So even if the teeth are aligned, but the gum tissue is uneven or the edges of the teeth have been chipped and worn out, you don't get that wow factor. So I don't think we give enough credit to that last step, but it makes a big difference for the patient. So I am a bit of a perfectionist, which is not anything to be proud of, but I think with dentistry, it comes in handy because it's all in the details. So in that last step, I do a little bit of grooming, and when that's completed, we finish it off with a complimentary in-office whitening. I really don't feel like I can make my patients any happier with any other procedure as I can with Invisalign. It's really rewarding to, see my patients smiling more confidently, and, know that I have something to do with it. It's very emotionally rewarding for me.
Well, you're doing great work, and being a perfectionist when you're a dentist is something that your patients love because you're giving them those beautiful smiles.
Yep, definitely. I think it's all in the details with dentistry. So
Invisalign delivers great results. You really take the time with each patient to customize the treatment to make sure that particular patient gets the best outcome for each patient. How long do the results typically last, Dr. Darvishian?
the results can last a lifetime as long as the patient follows the instructions. Both with braces and Invisalign, retainers are required at night, especially that first year. The ligaments have memory, teeth want to snap back. And wearing the retainers every night, basically, as the name implies, is going to retain the teeth in that final position. The retainers also act as a mouth guard, so you're separating your teeth at night. You're not grinding. You're not damaging your teeth. So once you get used to it, it's you almost can't sleep without it. Like I can't go to sleep without mine. Also, retainers make, as I said, great whitening trays. They're custom trays, so you could use it for that. So most patients, once they get used to it, they wear it, and with that, the results can last a lifetime.
I enjoyed my smile beforehand, but I knew that it could be more perfect. And I think everyone is drawn to a smile. That's one of the first things you see on someone's face, so I really wanted to enhance mine. I was really interested in getting the Invisalign treatment. That's what brought me to find Dr. Darvishian. I love the results. It was a very comfortable process. She made me feel very happy throughout the whole treatment. It wasn't terrible or hard or anything that was something I couldn't do at home. It was very smooth sailing, very quick, and I'm very happy with the results. Her and I are actually now close friends. I joke with my friends that I'm like best friends with my dentist, but she took a lot of time with me. Every time I came in, she would call me at home. I also follow her on Instagram, so I feel like her and I are very close now after my treatment. I would highly recommend Dr. Darvishian, one, because of the results. You can't argue with them. They're perfect. You definitely see them there. And two, because she's very caring. She loves what she does, and she makes an impact on all of her patients.
2 years ago, I decided I wanted to get my teeth straightened, and my dentist at that time recommended I get braces. But getting braces as an adult is a bit embarrassing, so I decided to get a second opinion. A friend of mine recommended Perfect Smiles of Reston. I was a bit hesitant to schedule an appointment since it was an hour away from where I was living. But after I read the reviews, I scheduled a consultation to meet with Dr. Darvishian. I was able to meet with her the next week. When she met with me, she examined my teeth and told me I was a perfect candidate for Invisalign. She told me that my case, since it's a little severe, it would take about 10 months. I was very pleased with the process and timeliness of my treatment. Not only did Dr. Darvishian straighten out my teeth, but she contoured and whitened my teeth just in time for my wedding. Not only would I recommend, but I have recommended Dr. Darvishian to friends because the comfort and care that she gives to her patients, I have not been able to get anywhere else. So driving an hour and 20 minutes definitely makes it worth it.
So Dr. Darvishian, you are considered as a top Invisalign dentist in this community. You're a top Invisalign provider. You're doing great work with your patients. We interview testimonials. They're very happy with everything about you. You take the time with them. You really care for them. You show compassion. They drive from long distances to come here, like all the way from Baltimore, like we heard from one of your patients as well. Can you please tell us about your vision for your practice and what you feel separates you from a lot of the other dental practices in the area?
As far as Invisalign goes, again, it's my experience. I've done thousands of cases, and as I said, I'm a bit of a perfectionist, so the results speak for themselves. But I would say the main thing that makes this office stand out would be the technology that we've invested in to make more accurate, more aesthetic, and more efficient restorations for our patients. For example, the 3D cone beam that we have here basically captures the elements in the mouth and jaw in 3D form, which helps us make more accurate diagnosis. I would say the most useful technology we have here is our 3D prime scan, which is actually the latest in the evolution of CAD/CAM dentistry. In this area, everyone lives a busy life. So when patients come with a broken tooth, we have that 3D prime scan where we can create a restoration very similar to the original tooth morphology and shape in just an hour. We deliver that final restoration in an hour so the patient doesn't have to, deal with temporaries and, save the patient several visits. The 3D prime scan especially comes handy in this office because I do a lot of Invisalign. And if a patient, has a broken tooth or gets recurrent decay under an existing crown during the Invisalign treatment, the biocopy feature allows us to create a restoration, the exact shape and morphology of the original tooth. So what that means is, we can go on with the Invisalign treatment uninterrupted, because if it was sent to the lab, the restoration that comes back is a different shape. So to start the Invisalign process all over. So this technology comes in very handy in this area. Because patients are busy and in an hour they're out and catching their meeting or catching their flight with their permanent restoration. Lastly, the iTERO scanner that we have, which we use mainly for Invisalign, again captures the 3D image of the teeth in just a couple minutes. Patients don't have to deal with those gaggy, gag-inducing, uncomfortable impression material, which can also have some distortion to it. So with the iTERO scanner, we also get more accurate fitting trays, so the treatment, also finishes faster with better results. I also definitely like to connect with my patients. I'm told I have a good bedside manner, and I think that's important to connect with your patients, because you could be a great clinician, but if you're not, connecting with patients, they're not going to allow you to do what you were trained to do. Last but not least, my biggest asset is my team. I think they really, make me look good. I couldn't do any of this without them. And as they say, nothing great is ever done by one person. So definitely my team is my best asset here. I always like to under-promise and over-deliver. So I always, discuss with patient if there is something I cannot do. If a tooth is rotated 90 degrees and I don't think I can get it to that perfect alignment, I will discuss all these with them up front. Sometimes, I surprise them and we do get it aligned, but I always like to, under-promise and over-deliver. And I always, guarantee my results. So I always keep going until both myself and the patient is happy with the results. So come visit us for if anyone lives in the area, feel free to come visit us for a complimentary consultation to see how we can give you that perfect smile.
Dr. Darvishian, you've established wonderful practice here in Reston, Virginia. Perfect Smiles of Reston has taken care and helped so many patients in the community really improve not only their smiles, but their lives. I mean, your smile is where your confidence comes from, so you're really changing lives. And the state-of-the-art technology that you have is unparalleled. I mean, you've got all the cutting-edge tools to make sure the patients get precise outcomes, to make sure their experience is very smooth, minimal to no discomfort. I mean, that technology really helps a lot. And I want to thank you so much for joining us today and being a guest on our program.
I appreciate you taking the time to do this today. Thank you.